We are asking questions about the boomer generation and their impact on the healthcare system. The baby boomer generation includes people between the ages of 60 and 79 right now. The 2020 census in U.S. estimated that there were around 73 million boomers living in the U.S. Right now, a lot of them are retiring and headed to senior living facilities. I'm joined now by Dr. Ann Stalter, a professor of nursing at Wright State University. Dr. Stalter, welcome.
Well, thank you very much for having me today.
Of course. So the baby boomer generation is known for being a big generation, and now this large cohort of people are retired and seeking senior health care. Has the country's health infrastructure been affected by this shift, and where was the strain the greatest?
Oh, yes, the healthcare system is under significant strain. Hospitals, primary care, and long-term and home health services are stretched very thin, especially in our rural areas. And the demand for senior care is outpacing the workforce and the resources available to care for them.
Yeah, and then senior living facilities seem to be popping up in a lot of communities. What does the workforce look like for these facilities, and did the baby boomer retirement wave affect healthcare employment?
Oh, yes, the workforce is under serious strain. We need more nurses, more nurse aides, and specialized caregivers. But staffing shortages are widespread. And adding to this shortage is that the baby boomers are leaving the healthcare workforce, and this has deepened the gap just as the demand has surged. In 2019, nearly 70% of healthcare providers in Dayton area had unfilled nurse aide positions, with almost 2,000 nurse aide openings just in Warren and Montgomery counties. So along with that, in Ohio this year, about 200,000 nurses renewed their licenses, but 27% of them are approaching retirement age and 15% have committed to retiring. If everybody in that workforce retires, we'll be down another 60,000 nurses.
And then, doctor, what are some of the most common health issues that the baby boomer generation faces?
Well, they're grappling with chronic disease on a massive scale. These chronic diseases include heart disease, diabetes, arthritis, and dementia. Roughly 93% of U.S. adults 65 or older have at least one chronic condition, and nearly 80% have two or more. This does not include a rising risk of dementia, which could impact approximately 42% of aging Americans. And these overlapping health challenges demand ongoing and complex care.
Mm. And so U.S. birth rates are declining, but right now the healthcare industry is expanding for baby boomers. So how could this industry change affect the next 20 years?
Yes, there is a brighter side as we look ahead. More seniors will be able to age at home, supported by telehealth, wearable devices, and remote monitoring that keep them safe and connected. Robotics and smart home technologies will ease the strain on caregivers while boosting some independence. And while we will also see new jobs created in health tech and home care, plus a stronger focus on prevention and healthy living. So instead of just treating illness, we'll help people thrive longer and have a higher quality of life. And it's my professional opinion that it takes more than caregivers. It takes baccalaureate and master's prepared nurses and entrepreneurial minded, policy ready nurses who are willing to serve on local boards and run for office and make positive changes for the future.
All right. Well, thank you so much, Dr. Stalter. We really appreciate you coming on today.
You're welcome. Thank you.